In health news this morning, brain tumors have gotten a lot of attention lately. Senator Ted Kennedy was diagnosed with a malignant brain tumor last spring.
And the brother of American Idol winner David Cook died this month from the disease, but plenty of patients are surviving this type of cancer. This morning, Fox 25's Katie DeLon joins us with one of these good stories.
Yeah, it's very inspiring. This guy is awesome, I have to say. You know, Robert Raines was diagnosed with a let me get this right, glioblastoma multiforme grade 4. Now, for a lot of brain tumor patients, that can just be a death sentence. But for Robert Raines, it was a second chance at life.
Raines was like most people.
I thought it was just a bad day or a bad couple of days.
Trying to get through life's rough spots. But suddenly, at age 42, his life crumbled.
Couldn't solve problems like I used to. I couldn't remember things.
Robert's bad days became more frequent and intense, much like his headaches ringing in his ears.
Sounded like listening to a seashell, like the ocean. I called it like a squishing sound if you cup your hands.
The sound proved something more serious, a tumor growing in his brain. At the outset, Robert's doctors at Mercy Hospital offered little hope.
I finally asked how long I had, and the doctor told me 1.5 years.
He underwent 2 surgeries, never letting his friends see him suffer.
I woke up in intensive care, and they were standing outside the window looking at me. And I'm laying there in the bed, and I woke up, and I see him. I just give him the finger. And she said, "He's going to be okay."
But privately, Robert worried about the burden his family would bear after he died.
All I had to do was wait. They were going to have to deal with me being gone.
Doctors said chemo and radiation would only prolong his life, so Robert sold almost everything he owned.
There was never the word cure.
While doctors never uttered the word cure, 5 years later, Robert is proof of a man beating the odds. In his new home, he keeps a reminder of a more difficult time, a radiation mask hanging on his wall. The other reminders? He wears those on his body. Some are more poignant, like the stars he gets tattooed for every year of survival.
Number 3 was pretty important to me, too, because that was twice as long as they told me.
Another answers the question to how he's doing today.
I'm doing pretty good. I said, I heard my alarm clock go off this morning. I said, I saw the sun come up today. It's going to be a good day.
And the tattoo on his leg, well, that speaks for itself.
Cancer sucks.
These days, Robert relishes the moments cancer didn't steal, like holding his first grandchild or a joyride on his motorcycle, and thankful for the new perspective on life.
You know, I told you I wouldn't wish this on anybody. I wouldn't trade it either.
Yeah, I think Matt said it best. What a character. And he certainly was a fun guy to talk to, but very humble about what he went through and very thankful for his family. And we are going to, coming up after the break, we're going to talk about survival rates and what that means for a brain tumor patient, because, you know, for a lot of people it can be the end, but for people like Robert, it can also be a second chance. So we'll talk about that.
Somebody could beat cancer. It's that guy.
Yeah. Man, he can just punch it right in the face.
Not going to mess with him.
If he can do it, anyone can do it. Absolutely.
Thank you, Katie. We appreciate it.
No problem. Well, welcome back. Just before the break, we brought you the story of Robert Raines. What an amazing guy. A brain tumor patient who doctors said only had 1.5 years to live, but 5 years later, Robert is working, doing well. He has some clean MRIs. Just one tough cookie. That's what you have to say about Robert. Now, this morning, Nancy Thomason with the Oklahoma Brain Tumor Foundation joins us. Now, Nancy, you know, brain tumors have gotten a lot of press recently, especially with David Cook's brother. He was the American Idol winner. His brother died after battling the tumor for 11 years.
Right.
In 11 years, he was in remission. So sometimes people think if they have a tumor, they're goners. You know, that
Right.
they're not going to live past a year or so. But what's the survival rate for a brain tumor? Really?
About 30%. It's very, very low. But the difference is for brain tumor patients is there's 120 different types of brain tumors.
Right.
And so your survival really depends on the type of brain tumor that you have and the location that it is in the brain and how successful they are in removing that surgically. And if you're able to get clear margins after the surgery and then go on and have some chemotherapy and radiation. We have, in our support group here in Oklahoma City, we have 2 glioblastoma survivors. We have one lady who's even been a survivor, I think, 8 years now. So we just don't know from,
Right.
we don't know what God has in store for us.
Right, exactly. And because I interviewed a couple people with glioblastomas. Some died. My mother passed away from a glioblastoma.
Right.
But you look at people like Robert and Gilbert left from last week, and they're surviving.
Right.
And tell us a little bit more about the foundation and the work that you guys do.
Well, we work with these families. We have a support group here in Oklahoma City. We provide financial assistance for families to help with prescription costs, rent, mortgage, utilities, transportation needs, those types of things, which is a huge need right now, given the economy. And we also have a patient navigator on staff, so we help to secure those other supportive services and make sure that we're working with other agencies in the community to meet all the needs of the brain tumor patient here in Oklahoma. And really, we're the only organization in the United States that's on a statewide community level that's providing these types of services for brain tumor patients. So
Great.
we're very unique.
Nancy, thank you so much for joining us, and it's
Thanks
been an
for having
amazing
me.
experience just talking to all these patients. And we also have that phone number that you can call. We've linked their website to ours. Just head on over to okcfox.com and click on daily links, and you can also find out how to be a volunteer as well.